In this video, I'll be talking about the mental health symptoms of long COVID. During the pandemic, we were dealing with, and even to this day, we're still dealing with a invisible virus of these different COVID variants. And I think not being able to see something definitely plays into this aspect of this fear where we can potentially become sick again from something that we can't see or know that someone has. Sometimes there's people who were asymptomatic who are still carriers of COVID. So this is a normative thing that people have stress related to, but at the same time, it can increase as we're getting back into normal routines or going to the grocery store or just re-engaging in our normal life. This is a great area where people can have spaces where they talk about this and learn how to deal with this anxiety. Because there's some anxiety that's definitely, justified and it makes sense because you want to protect yourself. But there's other anxiety that's above and beyond the level of what we're dealing with. That's a great thing where you can get some help and have somebody to bring some objectivity in to deal with this. Additionally, some of it's tied in with our body as well. That shortness of breath that we sometimes feel can sometimes trigger that anxiety. Or maybe it's even just the fatigue and wondering, can I handle the same things that I used to? What's it going to be like when I get back to work, or etc. So that's anxiety. The next one here is depression. And this is really this aspect of where we've had major losses in our physical and emotional health. Sometimes our relationships change as we're dealing with COVID. Sometimes people don't know how to deal with us when we're dealing with persistent symptoms, when maybe they had COVID and they were just fine or okay after a few days to a week. Sometimes the depression really sets in when we have fatigue or this inability to be as effective or productive as we used to be. And so this is where we can have a way where we process through this and adjust to this as well. The other aspect is the post-traumatic stress disorder or trauma symptoms. Sometimes people have nightmares of getting COVID again or being in a hospital or flashbacks, or maybe their mood has dramatically changed and they're avoiding things that they used to do. Or maybe they're just over alert to everything that's going on or thinking that COVID could be everywhere. The next thing on here is feeling distant or cut off from others too, or just even more irritable, angry, and upset. I mean, these are common things that come up, but COVID can definitely exacerbate this too when you don't have as much energy or it takes more effort to do things on a normal daily basis. It can also impact our ability to deal with death, loss, and grieving our changes in life. So these are some more of the mental health symptoms, and our goal is to help you to identify, hey, what am I potentially dealing with if I have long COVID? Or if someone else has long COVID, how can I better understand what they're dealing with? Now, this is a great video I have together on the causes and the symptoms of long COVID. Tune in because my next video, I'm going to be talking about some of the different treatments and where you can be looking for different supports. Like and subscribe, and please leave a comment if you've experienced any of these mental health symptoms from COVID, or if you know somebody struggling with long COVID.